Okay, Gormagot and Minister, I want to thank you for taking this session this morning. And I'll preempt it by saying that I would hope when you've gone through the discussion here that by the end of it you would strongly consider meeting with representatives of the families of the 68 patients in Cherry Orchard who are due to be moved, mostly against their will, to the Barta Healthcare Centre in Clondalkin in order to allow the refurbishment of 2 units, Sycamore and Willow. Now, many of us have drilled down and have been forced to drill down into detail that we wouldn't be familiar with, but I have to say that from the outset, answers to very serious questions that we have been asking are either vague, too short, or are not forthcoming, and certainly trying to equip ourselves with reports and documents that we think we need to see is not possible. Some of them have not been given to us. But really what I want to concern ourselves with today is we're a few weeks before Christmas and 68 very vulnerable patients are being told at the 11th hour that because of a health and safety stroke fire concern in the structure of the units that they inhabit, they're going to have to move to and I think this is worth noting, a private for-profit run healthcare centre in Clondalkin, whereas Cherry Orchard Hospital is a HSE centre, not-for-profit, very well staffed by some of the best people you'll meet in the care of others who are working there for years and years, and this transfer is cruel, to put it mildly, to so many patients and or residents and their families. And they've been protesting outside, the families have been protesting outside the hospital since, and I say well done to them for not going quietly and putting up with what I think is a proposed transfer that has huge serious question marks around it, which I will come to later on, or will come back to later on. But two asks of you is to try to halt that transfer, to delay it, to make sure that there's room and space for everybody's questions to be answered, that it doesn't happen before Christmas, and secondly, will you agree to meet representatives of the families?
Thank both deputies, Deputy Smith and Deputy O'Shnuddy, for raising this issue, and I know it has caused a lot of concern for the families and the residents. If it becomes necessary for an older person to move to a nursing home, their safety and well-being is of paramount concern, and we have to ensure that the highest standards of care are provided to all residents in a safe and secure environment. Cherry Orchard is a designated centre for the care of older people, located on the hospital campus in Ballyfermot, Dublin 10. The centre comprises 5 units: Beech, Aspen, Hazel, Willow and Sycamore, housing 95 residents in total. There are 68 residents in the Willow and Sycamore units. In May 2023, a HICWA inspection identified concerns in relation to the flooring in both the Sycamore and Willow units at Cherry Orchard Hospital. These presented a potential health and safety risk. A subsequent HSE review indicated that the flooring has underlying structural issues, including newly identified lack of fire compartmentalisation in the walls at a subfloor level and in the subfloor, which require immediate remedial work. A fire risk assessment report has identified that, while the risk of fire is relatively low, a maximum rating has been assigned to the potential impact of any fire, which would be severe due to a combination of factors, including the dependency level of the residents. The HSE has assured my department that there is ongoing monitoring and risk assessment by the service to ensure there is no immediate hazard to residents. In consultation with HICWA, the HSE considered several plans to address the required works that would have allowed residents to remain on site during their completion. However, it was agreed that to ensure the health and safety of residents, to minimise disruption during these works and to comply with HICWA requirements for a shorter timeline for completion of works, the Sycamore and Willow units will close for a minimum of 12 months. I have been advised that there is no impact on other structures on the campus, as the issues relate solely to the 2 modular buildings, which are Willow and Sycamore. The safety and well-being of residents and staff is our primary concern. Residents and their families will continue to be consulted with, informed and reassured regularly about the move. There will be a medical social worker and an assisted decision-making lead available on site for the duration of the move. In addition, all residents have on-site details to an independent advocate service should they wish to contact them. Deputies, last week I met with the National Director and Assistant Director for Community Operations Services for older people in the HSE, so these would be in charge of the CNUs. All residents will remain under the overall care of the HSE. I have stressed the importance of communication with families and residents so that they are aware of what is happening. It is proposed to move the residents to Clondalkin Lodge nursing home on a phased basis. The phased move will have due regard to the residents' needs, their current proximity to each other and relationships within the unit. Medical officers will follow and review each resident on transfer and for a period of a minimum 3 months after that. The HSE has reassured my department that each care plan for this temporary move will include therapeutic input required and a review of charges to ensure that no one experiences adverse financial exposure. All additional charges will be covered by the HSE for the duration of the works, and when these extensive structural works are complete, everyone will move back to Cherry Orchard site. So just to reiterate, all residents will remain in the care of the HSE at all times, even when they are located off-site. There will be no additional charges. We all know in private nursing homes there's extra charges. There will be no additional charges. And all support such as physiotherapy, occupational therapy will be provided to the residents. I have made that crystal clear. An initial visit to the new nursing home was well attended by residents and family, and further visits are planned.
Commitment that all residents will remain in the care of the HSE. I don't doubt that that statement is true, but unfortunately the transfer on a like-for-like basis is not going to be like-for-like. So, for example, what jumps out immediately is that in Cherry Orchard there's a 24-hour, 7 days a week medical team on site. In Bartra, in Clondalkin, there'll be 1 day a week that a GP will be present. If your father, my father or mother were there and got sick in Clondalkin, they'd go to the hospital that they normally attend, for most of them St James's. If they get sick in Clondalkin, they'll be sent to Tala, place that they haven't attended where their records are not kept. So they may be in the care of the HSE in theory, but in reality the like-for-like care is not the truth of what's happening. I really do want to appeal to you, because you've repeated that there is no immediate hazard to residents insofar as that they're ensuring that there's no immediate. I really want to appeal to you to put a halt on this, to allow us to dig deeper and ask more questions. So, for example, is it not a conflict of interest that one of the chief movers and shakers of Bartra and Clondalkin is a former HIQA inspector? Is it not a conflict of interest that those who carried out the inspection on the Willow and Sycamore units don't have engineering qualifications? We need answers that go much deeper than what we're getting.
Deputy, my primary focus is the health and well-being of the residents, and I have to listen to what HIQA say. And HIQA will deregister this building if these works aren't carried out. We have to put that on the floor of the Dáil. They will deregister. Several older units at Cherry Orchard, now used for storage, were reviewed. They could not be considered because they are not habitable, they are deregistered, and they would require a substantial amount of work and time to bring them up to a habitable and registration standard. The HIQA have advised my department that the HSE is required to undertake structural and fire safety works in these buildings. We owe the residents a duty of care, quality care, and patient safety has come first. And I know not for 1 second are ye disputing that. You have said it earlier on. Many of the residents and their families visited the new site last week. Some more visited the site this week. And I have spoken to families. I actually have a constituent in Waterford whose uncle, she's his main contact, and she attended the meetings there as well. And I do think, and I will be honest to say, that communication at the outset was poor. And that's why I met with the National Director and the Assistant National Director, to try and find out exactly what's happening. But first and foremost, we have to put the health and safety of the residents first. They will be moved off-site. They will remain in the care of the HSE. There will not be any further. There will not be any extra charges that normally happens in a private nursing home. But to Minister or to Deputy Smith's question in relation to, I have been assured that all medical supports currently available to the residents will follow, and I will certainly keep it under review. I have been contacted by several of the families, and I have written back to them to explain what the situation is. You asked me, will I put a pause on this? I won't request a pause. I have to listen to HIQA. I have to make sure the residents are safe. Thank you.